Good afternoon. Thank you for joining us. My name is Tina Tebow and I will be your moderator for today's news conference. Joining us today, the Honourable Ian Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Thanks for joining us today. Let me start with the news that Health Canada has just approved the Johnson & Johnson vaccine for Canada. This is the fourth vaccine to receive approval, and it is a positive step forward on the vaccine rollout path. As you can see, this is a very dynamic situation that is dependent on the federal government's regulatory approval process. And in Nova Scotia, our vaccine rollout is ramping up as more clinics open and we receive more doses from the federal government. Now to today's cases. There are two new cases today in the Central Zone. One is a close contact of a previously reported case, and the other is under investigation. In total today, we have 31 active cases of COVID-19 in Nova Scotia. 3 are in hospital, with 1 in the ICU. We still have a number of cases under investigation, and that is something Dr. Strang and his team are working on closely. While our case numbers are staying low, the cases without a known source of infection could indicate a low level of COVID activity that has not been detected yet. I was pleased yesterday that we were able to lift most of the restrictions imposed last week. I know these decisions can be hard on business owners, but they are necessary to protect public health. The cooperation of all Nova Scotians is how we kept our cases low, and I want to thank our fellow citizens for adhering to the guidelines to protect your friends and your family from the virus. Dr. Strang will say a bit more about this, but ultimately our message is this. Please continue to be cautious, practice good health protocols, and make sure you keep your social circles small. Our testing numbers remain impressively high, with the Nova Scotia Health Authority's labs completing 5,589 tests yesterday. We actually hit a record high earlier this week with 6,875. This demonstrates how Nova Scotians are prepared to step up in the fight to keep everyone safe. So thank you for that. Let me say, too, that I'm very pleased there's a plan in place to roll out our first shipment of AstraZeneca. I want to thank Doctors Nova Scotia and the Pharmacy Association of Nova Scotia for their willingness to work with us to make this happen. I look forward to being able to share more details about this plan next week. As I mentioned yesterday when speaking to reporters after Cabinet, the extension of the interval between the first and second doses of COVID-19 vaccine are going to 16 weeks, and that could see all Nova Scotians who want to see vaccine getting their first dose by the end of June. We are dependent, though, on the federal government approving and securing supply, but we are committed to being ready to getting shots in the arms when it is available. Dr. Strang called the 16-week extension a game changer, and that is an apt description. As new vaccines come on board and our supply increases, we'll continue to adjust our delivery plan to ensure we're getting vaccine in arms as quickly as possible. Our goal remains to get full immunity by the fall. Thank you, and I'll now turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. As the Premier noted, our case numbers remain low. Compared to last week, things are looking much better, so much so that we were able to lift most restrictions early. We still have a number of cases where a known cause of infection has not been identified, and several of them are complex with a large number of contacts. So there could still be a low level of undetected COVID-19 in the Halifax area. That's why testing is so important. As the Premier again said, in true Nova Scotia fashion, as we asked people to get tested last week and last weekend, you certainly responded. So I remind people that it's still important to get tested. Go online to find out where you can get a test this weekend. It's on the Nova Scotia Health Authority website under coronavirus testing. Whether you've had multiple symptoms, you have one mild symptom, or you even have just been in contact with multiple groups, whether through work or your social activities. All of those, we ask you to build testing in as part of your regular COVID precautions. A little bit more on restrictions. We did issue a press release yesterday with details, so I won't repeat everything today, but I would like to talk why there are still a few restrictions in place. As I mentioned earlier, we still have cases with no known source of infection. That means we still have some virus activity, and we still need to be careful about things like large social events, especially in HRM and surrounding communities. That's why in the affected areas of Halifax and their surrounding communities, only venues who have approved plans based on specific guidelines from the Department of Community, Cultures and Heritage can have spectators or an audience. And they should be ready to produce those plans for compliance officers when they are asked. And I know most facilities have these. They had them from the fall. But we're requiring those approved plans to be able to have crowds. There can still be no organized social events, festivals, or special events. And residents of long-term care facilities can only have visits from their 2 designated caregivers and can only leave the facility for medical appointments or for a drive with a designated caregiver. For now, these restrictions will stay in effect until March 27th. I'd like to give you an update now on vaccines. It's certainly been a busy week with several key developments. On Monday, we opened our community clinics for online and phone booking. On Wednesday, the National Advisory Committee on Immunizations announced that the interval between the first and second doses of COVID-19 vaccines can be extended to 16 weeks. And also on Wednesday, Health Canada announced new, less restrictive storage requirements for the Pfizer vaccine, which allow it now to be transported and stored at standard freezer temperatures rather than the ultra-low frozen temperatures. These are positive developments, and as we've said from the beginning, our plan is flexible, and we are able to respond in a way that gets vaccine into arms as quickly as possible. So I'd like to just provide a bit more detail on a couple of the new developments this week. We have pivoted quickly to develop a plan for AstraZeneca. And I do also want to thank the Pharmacy Association of Nova Scotia and Doctors Nova Scotia for stepping up to urgently plan the delivery of this vaccine. We're working out the details now, and we'll have much more information to share next week on all the specifics about where and how to access appointments and where the vaccination clinics will actually be. We know it will be a first-come, first-serve for Nova Scotians aged 50 to 64, and people will have a choice. We'll have more information to help people make that informed choice to choose whether they want to get an AstraZeneca vaccine now or wait to get one of the other vaccines in the coming weeks. I also want to talk about the change to the interval between the first and second doses of vaccine. The Premier used my words, and I'll say it again, this is an absolute game changer for us in public health. Across the country, all my colleagues were saying the same things. It means that we no longer have to hold back the second dose of vaccine to be used for 3 to 4 weeks. We can now have a 16-week time interval before we need to offer the second dose. What that means is we can focus all our vaccine and all our efforts in the coming weeks for Nova Scotians to get their first dose of vaccine, and that means our timelines for that first dose of vaccine move up significantly, much more than our original planning. So we're now in a position where we anticipate that by the end of June, all Nova Scotians who want a COVID-19 vaccine will have received their first dose. Previously, we were looking at September. But we have to remember that the end of June target is dependent on a consistent vaccine supply. And of course, if more Nova Scotians want vaccine than our planning number of 80%, and I certainly hope that is the case, then it'll take a little longer to get all those extra people their first doses. But every time a new vaccine comes on board, and we heard today about the Johnson & Johnson, and that will be coming, we have to get approved by NACI, and we know we'll start to get that at some point in April. So every time a new vaccine comes on board, or we get an increase in supply of existing vaccines, that just increases our opportunity for Nova Scotians to get vaccinated. When most of the adult population has at least one dose of vaccine, we will have a good level of population immunity. But we have to remember that to sustain that immunity longer term, people will need to receive their second dose, and that will be our focus through the summer and the early fall. And again, you'll hear me say this many times in the coming months. It's as critical as it is for people to get the first dose, it'll be equally important for them to follow up and get their second dose. And that's what we remain focused on. That full immunity is our end target through our immunization program, full immunity through 2 doses. My final comment on vaccines is about the booking appointments for community clinics for starting with Nova Scotians over the age of 80. Monday was not a good day for anyone who tried to book an appointment. I recognize it was a frustrating and never negative experience for many. We know we need to do better, and we will. Booking for new appointments, and this is for people 80 and above, will resume this coming Monday at 7 a.m., and we put some things in place to ensure it's a much better experience. While people can book via phone and online, Monday's experience has shown us that the majority of people are booking online. To ensure that people don't spend lengthy periods of time trying to book online, we are dividing up the over 80 age group into 3 smaller groups based on month of birth. So those born, they're January 1st to April 30th is the first group. The second group is May 1st to August 31st. And the third group is September 1st to December 31st. So on Monday, those born between January and April will be able to book their appointments. Booking appointments for the 2 other groups with later birth months will open up later this month. And when we're able to open those up depends on how the appointments go for the first group of January to April. But we will ensure that everybody is made well aware when their opportunity to book based on their month of birth comes up. If you try to book Monday and you weren't born, if you're not over 80, first of all, and second of all, if you weren't born between January 1st and April 30th, your information will not be accepted and you will not be allowed to book an appointment. If you decide to call to book an appointment, please know that there are a limited number of lines available. You'll either be placed on hold if the lines are full, and you'll have to wait. So we ask people, whether online or calling, to just be patient. You will get through. We put these steps in place so we have a more manageable numbers of people at any given time looking to book their appointments. But everyone who wants to get a vaccine will get one. I know people are anxious and want to get the vaccine, and that's great. That's wonderful. But we do need to be patient. We have lots of people to get through. This is a month-long program, so have a little patience as you get, and we'll get to you in time. I've given a lot of information today. I know that many thousands of Nova Scotians watch these briefings. If you do want more information at any time on our whole on COVID vaccine, our whole approach to the pandemic control, then you can go to novascotia.ca/coronavirus. I'd like to leave with a few reminders. Please, we can't afford now to jeopardize the hard work we've done over the last year. We are still in a pandemic. As much as people are tired and want to be out of it, we are in a pandemic, so we need to continue for the next few months. All the COVID protocols, and I especially want to emphasize the need for people to limit their social activities, keep their social circles small and consistent. On the vaccines, it is early days, and our supply is still limited, but we're on the cusp of rapidly expanding the volume of vaccine we'll get, and therefore the opportunities for Nova Scotians to get immunized. There'll be more and more points of access close to people's homes as we roll this out in the coming weeks and months. We are confident in our plan, but we know that this is a big, complex effort, one of the biggest efforts we've ever done in healthcare in this province. So we won't always get it right. A vaccination effort of this magnitude has never been done before. But I can tell you that each time that something goes not as we expected, we will learn and improve. We have teams of people who I want to thank. They're working tirelessly to make sure we get Nova Scotians vaccinated as quickly as possible. So as we go into another weekend, have fun, stay safe, and do your part to keep case numbers low. By keeping our numbers low, that means we can focus our efforts on getting vaccine into your arms. Tina.
Thanks, Dr. Strang. Again, just a reminder, we'll take one question, one follow-up from reporters in the room first. We'll then go to the phone lines, and we'll come back to the room if we have time. We'll start with Alicia Drouse from Global. Go ahead, Alicia.
Thank you. Just in terms of getting that first dose by June, What does that mean, I guess, for travel? Obviously, we've been locked down, or not locked down, but we haven't really been able to leave the province without self-isolating for a year now. Would that change come June, or do we have to wait for that second dose?
So there's a lot we're waiting to learn more about the vaccines. Right now, we know that the vaccines are effective at preventing symptomatic illness, certainly very good at preventing severe illness hospitalizations. We expect that they will, but right now we don't have enough proof that the vaccines actually prevent asymptomatic spread. So right now, if somebody's immunized, we don't know for sure that they couldn't still become infected and with no symptoms and still be passing the virus around. So for now, until we get better evidence, people, even if they're immunized with 1 or 2 doses, still have to follow all the COVID protocols. We still have to have COVID restrictions at some level. And once we get into June, I think we'll have to assess where our epidemiology, not just locally, but across the country. The vaccine, as I say, I do use the term game changer, but we have to understand we're going to have COVID restrictions and COVID protocols for a number of months as we learn ultimately what is the ultimate impact of having people, large numbers of people vaccinated.
Go ahead, Alicia, with your follow-up.
And just in terms of AstraZeneca, I know that you said you guys will release more details on the rollout next week, but there's lots of questions right now about this first come, first serve. So is this going to be an online booking first come, first serve, or a lining up outside a doctor's office first come, first serve?
So as I said, we're working with pharmacy clinics, physician clinics. The booking is going to be part of our online booking process. Much more details to come, but it'll be people at 50 to 64 if that's the choice they make, and we're developing the materials so people have the information to make that choice. If they choose for AstraZeneca, then they'll be able to go online and book the information, one of those AstraZeneca clinics.
Next, we'll go to Paul Withers from CBC. Go ahead, Paul.
Hi, I just want to follow up the point. So what does change after you have the one shot? If it's realistic that it's going to happen by the end of June, so what does actually change for Nova Scotians in their daily lives when it comes to public health guidelines?
We don't know exactly, but what we do know with a high level of population immunity, that the chances of widespread and especially the chances of severe illness become much less. It's an ongoing discussion. My national call I was on yesterday, we're looking at, so what actually do we start to be comfortable letting go when we get a high level of population immunity? Because of some of the questions around how long does the immunity last from vaccine, this important question about asymptomatic ability to be an asymptomatic transmitter if you are vaccinated or not, that's very important to have an answer to that. But I think I want to be optimistic. I think we'll be in a much different and much less restrictive environment as we get high levels of population immunity. Exactly what that looks like, it's too early to tell that. Again, some of it is just knowing the science, but also seeing how the epidemiology evolves. One of the outstanding questions there is what's going to happen with the variant. Are we going to get a resurgence or a third wave with the variant? That's a big question mark out there. And all of this means that we still need to, in the short term, the next 2 to 3 months, we need to remain very cautious.
Go ahead with your follow-up, Paul.
And I guess I'll do either one on Johnson & Johnson, which is what Canada is talking about right now. When do you expect to see Johnson & Johnson in this province? I thought I heard April. And what impact do you expect it to have on rollout, on vaccines and shots in the arm? So when does it get here, and what does it mean when it gets here?
Go ahead, yeah.
All I know today, I checked with my team, we have no, it's April. We have no certainty on a date or specificity on a date. That'll come from the federal government. It is a single dose, which means there's been a lot of discussion that probably one of the best ways to use the Johnson & Johnson single dose is in some vulnerable populations where getting them back for a second dose may be more of a challenge. But we also have to look at, we've we've made a priority for many vulnerable populations already. Right now, we're using the Moderna and Pfizer vaccines. So once we get more information on the details on the amount and the timing, then we'll have some discussions about, like we did with AstraZeneca, what is the best way to use that vaccine in the Nova Scotia context as adding it into our program.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Following on my colleague's question with the use of Johnson & Johnson, understanding there was evidently some hesitation and confusion around the AstraZeneca use plan, can you tell us a little bit more about the logistics and why Nova Scotians should be confident in our plans for these new vaccines that come out, given what's going on?
So, as I said, we're working with the Pharmacy Association and the Doctors of Nova Scotia. What I can tell you today is we know that we can, up to 26 clinics, we can get delivery of that vaccine directly to those clinics. So we're working with those two organizations to have 26 clinics dispersed across the province where people, if they choose, could make an appointment and go get AstraZeneca vaccine. One of the reasons we're able to get it out directly into pharmacies or some doctors' offices is because it's a fridge-stable vaccine. The storage and handling is exactly like flu vaccine, which they're used to this. We're used to the distribution, and they're used to the storage and handling in their office setting with those products. We're going to give information to people around all the COVID-19 vaccines produce good protection against symptomatic illness and a good protection against severe disease. There is a difference in the effectiveness, though, between the AstraZeneca and our Pfizer and Moderna vaccine. And so we feel, like other provinces, that that difference is enough that people should be able to make their own choice. If they feel that they're at risk and they're comfortable with the AstraZeneca vaccine and they're in that age group, they'll have a choice to get that. If they choose not to, then they can still certainly be able to get the other vaccines. It just may be that they have to wait a little longer till they can get those vaccines.
Go ahead, Lindsay.
And given what we know about Johnson & Johnson, do you expect this to be administered also in doctors and pharmacies? Is this something that we can use on our older population, or will it be restricted like AstraZeneca?
So that'll depend on where we figure it's the best use of it within our in our program, which then informs what is the best delivery method to use that. If it's targeted for some vulnerable populations, well then maybe getting them to go to a doctor's office may not be a good solution. So we'll figure out the delivery method when we figure out what is the appropriate or the best population and how to use the single dose vaccine for. Some of that depends on the amount we're going to get as well.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Excuse me, Dr. Strang. Things are moving fast, and just last week, the chart showed, younger people especially wouldn't get the vaccine until into September, and you at that time said that by then we would know the effect of the vaccine on children. So my question is, with the speeded up timeline, will children get that first dose in June?
None of the vaccines are licensed for anybody. The Pfizer is 16 and older. The rest of the vaccines are 18 and older. So we have at this point in time, we have no COVID-19 vaccines in globally for children and younger youth. If that changes, then of course we need to build that into our vaccine program. But I don't anticipate that we're going to get that change in the next few months. There are trials going on for younger people, but that's a whole other group that we then have to add on to our vaccine program, which of course would then push things out.
Go ahead with your follow-up.
I wonder if you could speak just a little bit to, and you say the information's coming, that's fine, but how am I or someone in the public supposed to think about the efficacies of the various vaccines? AstraZeneca at one point, Johnson & Johnson at another. I've read a lot, and Pfizer and Moderna at another still. I've read a lot of very conflicting information on that. And related to that, will the province be mixing doses? Like the first dose will be one vaccine and the second might be another?
So I'll answer the second point. Right now, there isn't data that would allow us to mix vaccines. So all of the products now are licensed that if you start with a product in first dose, you have to give that to the same product for second dose. That may well change, but we're not there yet. It's all because we're moving so fast with the clinical trial data and everything, and typically with a vaccine, we wait for all these questions to be answered through the clinical trials. Then it's brought forward and it's licensed, and then we implement a vaccine. The data is being reviewed. The license services are being given by Health Canada as data evolves. The NACI recommendations are given at a point in time, and all that changes over time. So that's why we need to expect that we're going to have to adjust our program as new science evolves on any of these vaccine products. So, but right now, if your first dose is one vaccine product, right now we have to give you the same product for your second dose, but that might well change. And I went on so long, I forget your first question.
How am I to assess?
I can't get it. That's what I got my team working on that right now. How do you synthesize all this into simple information that will help Nova Scotians to make that choice?
Next, we'll go to Natasha Pace on the phone line. Go ahead, Natasha.
Thank you. Dr. Strang, do we actually have the AstraZeneca vaccine in Nova Scotia now? And if not, when are we expecting to receive it?
We were expecting to get that. I don't actually have the answer that where we have it in or not, but I know that we are on target to, not next Monday, but the Monday after, start getting that vaccine into arms.
Go ahead, Natasha, with your follow-up.
Okay. Now that we can wait 16 weeks between the first dose and the second dose, when will Nova Scotia stop holding back the second dose? I think on Tuesday we heard there was just over 18,000 doses in the freezer for second doses. So when will we stop holding that second dose back?
So anybody who already has an appointment for their second dose, we'll honor that. They'll still keep that appointment at 3 or 4 weeks. But starting Monday, when people come online or start booking appointments, they will be given an appointment that is then 16 weeks out. So anybody who has an existing appointment will still be there. They'll still get that 3 to 4 weeks. If you're coming forward now, making an appointment for your first dose, you will starting Monday. You will get your second dose automatically booked at the 15 to 16 week period.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. As regards to the choice around AstraZeneca, is there any advice that you have for Nova Scotians, given our epidemiology and they have some kind of underlying condition, whether they should take their chance with AstraZeneca or is it recommended that they actually wait for maybe one of the other 2 or 3 vaccines that are online? I guess that goes directly to this idea that you say you have choice, but you can only make an informed choice with more information. So what's your advice to those people?
Well, I mean, you got let us work the information. What I'll say today is we know that all the vaccines provide a good level of protection and a good protection against severe disease. We'll produce information that Nova Scotians can take around and assess that. Ultimately, we want to make sure Nova Scotians, we're not going to tell them what to do around these two, the mRNA versus the AstraZeneca products. They're both types of vaccines are effective, but we feel that we need people to be able to make a choice, whether they feel that they're concerned enough that they want to get vaccinated as quickly as possible versus being comfortable waiting for a little longer to get one of the mRNA vaccines.
Go ahead, Keith, with your follow-up.
Yes, in terms of the availability of vaccine, what's your understanding about in terms of actual volumes that we can receive? Are we getting anywhere near what we potentially could get? And could this ramp up even faster based on what you know from what the producers are actually producing of these various vaccines?
Yeah. Right now we're scheduled, we get guaranteed in 2-week blocks from the federal government. So right now we know we're getting until the end of March, roughly 10,000 doses of Pfizer vaccine per week. And we have another shipment of Moderna coming in. We have the 13,000 doses of AstraZeneca vaccine. once, and it's not guaranteed, again, you have to make that statement, but the projections based on what the federal contracts are with the manufacturers, the expected delivery into Canada, then our per capita allotment, once we get into mid to late April and May and June, we expect to get 10 to 12,000 doses per day. Or enough vaccine to give us that 10 to 12,000 doses a day. So we're actually 10,000 doses a week right now with Pfizer. We're building our maximum capacity for delivery on immunizing 10 to 12,000 Nova Scotians per day once we get into late April, May, and June.
Next, we'll go to Nabal Snan from the Chronicle Herald. Go ahead, Nabal.
Good afternoon. Dr. Strang, I was wondering if you can tell us a little bit more about the national adverse event following immunization reporting. So do people report any side effects they have directly through a platform, or is it done through a health care provider?
So people are, at the time they're immunized, they're given information, or before they give their consent to get immunized, they're given information on what are the expected type of side effects. Like almost all vaccines, there's some risk of having some redness, swelling, tenderness, what we call a local reaction. They're given all that information and also with the other things they need to watch for, and then they're told if any of the anything that's severe or unusual, that they should seek health care attention for that. We also, long-standing process, for all our vaccines, anybody who provides a vaccine, there's a requirement that if anybody presents to them with a severe or unusual event that's happened to their health after being immunized, and I have to say, this doesn't necessarily mean that it was caused by the vaccine. They don't make that judgment. It's just that something happens in close association in time after getting vaccinated. We don't ask people to report the expected type of reactions, but anything that's severe or unusual, then that healthcare provider is required under our Health Protection Act to report that to local public health. And we have a process, we have forms that they do that. We then collect, all that stuff comes into us provincially, and we keep an eye on that for any vaccine product. What we're looking for is there any signal of any unusual type of event that's happening with a batch of vaccine that we need more investigation. We also then report that up to the national level. And at a national level, the same process is happening, that maybe there's one or two events in Nova Scotia, and then lo and behold, in New Brunswick, there's a couple of events that link back to the same batch of vaccine. So they're doing the same assessment of looking for signals of something unusual at a national level, the same thing we do at a provincial level. And if there is a signal, then there's a whole process to rapidly further investigate that. And there's also a whole process for any severe, unusual things, what we call causality assessment, to actually go through to do the work and say, what is the likelihood that this adverse health event was actually caused by the vaccine in the first place? Because some things get reported just because it happened at the same time you got vaccinated by no means that it was caused by the vaccine. So that's the process, starting from reporting to going to see a healthcare provider and how that gets all reported up to a provincial and a national level.
Go ahead, Nabal, with your follow-up.
Thank you. I was wondering where we are in discussions about how people who don't have MSI will be getting the vaccine.
So we're looking at several groups, foreign students as one. So as we get more vaccine and they become eligible, there'll be lots of communication out to those groups. Essentially, it's going to be built in that they'll be able to do a phone line where there'll be an assessment about, even though they don't have an MSI card, do they meet one of our eligibility criteria for still receiving a vaccine here in Nova Scotia. But lots more information on that will come as we roll out. We're just at the beginning of rolling out our broader vaccination program. We focused with a small amount of vaccine on healthcare workers, long-term care facilities, and we're just now starting to roll it out into communities. So things like the question you're asking, there'll be lots more information to come in the coming weeks.
Next, we'll go to Victoria Walton with the Coast. Go ahead, Victoria.
Thanks. Similarly, talking about the phone line and people who might not have MSI cards, I'm wondering if, or even people who do have MSI cards, I'm wondering if there'll be English language interpretation for people who don't speak English as a first language. Are there people answering these calls in other languages?
Yeah, we have, like we do with our 811 line, there's a number of steps that could accommodate a variety of languages, for sure.
Go ahead, Victoria, with your follow-up.
Okay, and Strang, this one's also for you. Talking about people who aren't from here or who might be leaving the province soon, how will we give one dose of vaccine to someone and then say, would another province, if they were to leave, be able to give the second dose? For example, either a Nova Scotia resident who's here for their first shot in the summer but leaves for school out of province in September, or vice versa?
Yeah, I don't know specifically about other provinces, but that's one of the things we'd certainly, look at, where if somebody's going to be here for a substantive period of time in Nova Scotia, if they've gotten their first vaccine somewhere else, we will give them that second dose. We've had a number of ones already, people who are, for instance, we have healthcare workers who go work on a rotational basis up in the Northwest Territories. They got their first dose of vaccine as a healthcare worker in the Northwest Territories. They're now off on a period of off work. They're back here in Nova Scotia. They're due for their second dose of vaccine. We've given them the vaccine. What we will not vaccinate, though, is what we call vaccine tourism. If somebody wants to bring a relative to Nova Scotia just because they think they might get a vaccine faster, that we're not going to give you a vaccine. But if you have a legitimate reason for being in Nova Scotia, like a foreign student or a student from another province who just somehow they're now here and now they need their second dose, we'll accommodate that. But we're and all provinces are the same. We are actively going to discourage vaccine tourism or travel.
Next, we'll go to Alan Johnson from 94.1 The Breeze.
Question for the Premier. Good afternoon.
Afternoon.
I have been in touch and reading the open letter to you from the three Conservative members of the House from Pictou County, Pat Dunn, Carla McFarland, and of course Tim Houston. The open letter to you this morning asks why you're forcing people over the age of 80 to drive to either Truro or Antigonish over Mount Tom on a less than desirable highway at this time of year, one of the highest points in the mainland. And from Pictou County to Antigonish is 45 minutes on a partial two-lane. Since the Conservative Party and the three MLAs from here put that letter out, we've been bombarded with calls from older people who are concerned and agree. And it doesn't sound, from me actually answering the phone on a number of those calls, that it's a political bias. But do you think that's something that can be reconsidered?
So I did see the letter this morning. It wasn't brought to me when I met with Mr. Houston virtually about a week ago. But certainly I've already had the discussion with Dr. Strang. He may have some comments, but there's only so many locations that we've set up, and they're relatively equidistant. But I'm well aware of that highway. As you may know, my wife's from Antigonish. I travel that highway quite a bit. So we'll be looking at solutions and trying to find a way to make sure that all Nova Scotians, whether it's in the Pictou area or throughout every region in the province, has access to the vaccine as soon as possible. But Dr. Strang is looking into that specific region.
Maybe I can just add to that. So we started off by developing 10 community clinics around the province, based at the same locations where we had our healthcare worker clinics, because that's where we have the various types of freezers. That's a starting point. We've only had 74,000 doses of vaccine into the province so far. So I think some people are under the perception that we have large amounts of vaccine. We're just beginning our vaccine program. The starting point for community clinics was those 10 sites. And a key reason those sites were chosen was to have as much of the population as possible within an hour's drive of any of those sites. Pictou County's in the middle, but there is an hour's drive either way to Truro or down to Antigonish, and we're getting lots of people from the Pictou, New Glasgow area coming to those clinics. But that's a first step. We know that we have to improve access in many communities, including in communities in Pictou and New Glasgow, and that's why we'll be building on other options through whether it's the pharmacy option options, whether it's physician-based options. So again, we're just at the beginning. We recognize that that there are access issues. We knew that from the very beginning there would be access issues because we have to build slowly within the supply and within the storage and handling requirements for the vaccines. But we will be ramping up and improving community access, not just in Pixo, in areas around the whole province as we build other types of models of community vaccine. I have to point out we have immunized 2 long-term care facilities in those communities. So we're certainly aware of the most vulnerable in those communities and vaccinating them as quickly as possible.
Go ahead, Alan, with your follow-up.
Just back to the Premier. Thank you, Dr. Strang. So what you're saying is the insinuation on the street over this way is that these 3 ridings voting with the opposition side of the House in the last election are being punished by forcing people who voted the wrong way to drive an hour in either direction to get vaccinated. That's not true.
We built our selection on our sites was built on sites that had the capacity to handle the ultra-low frozen temperatures, that they're typically hospital-based and they could bring lots of healthcare workers. But we also chose the sites as well as maximizing the population that would be within 1 hour's drive of one of these major clinics. Those are the criteria that were. It had nothing to do with anything other than those very objective criteria. And we always knew that there were going to be parts of the population that we need to improve access. But again, I have to ask, people need to be patient. This is a months-long program. We have to start somewhere with a limited supply, limitations of how the vaccine can be stored. As we get new products with less restrictive storage and more vaccine, we will roll out broader models that bring access to people.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Good afternoon, Dr. Strang. I'm wondering if you could help square a circle for me. I know that you have been part of the vaccination program has targeted health workers because they do face-to-face patient care. That makes a whole lot of sense. But my understanding from people contacting me is that there are people who go out into the community, Nova Scotia Health Authority therapists, for example, occupational therapists, physiotherapists, who go into other people's homes who have been told that you don't book appointments, you're not in line to get your shots. And I was just wondering your thoughts on that and whether it makes a whole lot of sense.
So we started with healthcare workers, and most of them were hospital-based. Anybody and paramedics who were who could be in direct contact with a known or suspected or possible COVID patient. We're now shifting to more community-based healthcare providers, starting with physicians, nurses, dentists, dental hygienists, and those groups. And from beyond there, then the other types of healthcare providers. There's a couple of dozen of regulated healthcare professionals that all of whom have some contact with patients in some format. That again we need to get to sequentially over time. If we try to clog up all our put everybody through at once, then it becomes unmanageable to get people through our registered and through our clinics.
Go ahead, John, with your follow-up.
Great. My follow-up is for Premier Rankin. Premier, you mentioned that in your opening address that businesses have been hurt by these shifting restrictions, and I know that a lot of businesses, in fact, have been hurt. What the government has done so far, what governments, both you and Ottawa, have done so far, in many cases is long gone. I'm just wondering what your message to them is about what you're ready to do in terms of being able to help them continue to survive this winter into the spring and summer in the upcoming budget.
So we've already announced, Jean, a significant package for those businesses that were impacted the most from restrictions, those service-oriented businesses, restaurants, spas, body art establishments, hair salons, etc. So we've rebated 50% of the property tax over the last 6 months. That's cash in their pockets. We understand the restrictions do have an impact on their cash flow, and that's why we acted quickly. But we have to look out for public safety, so we won't hesitate to put on restrictions where warranted. And once we were comfortable, we lifted those. But that was the immediate injection of funds. Look forward to more support if it's warranted.
That's all the time we have for questions today. Go ahead, Premier.
Thank you. As you heard, we have a plan starting Monday for our over 80 population. Of course, we all need to be patient, but we believe the plan that we have in place now will address some of the frustrations from earlier this week. And Dr. Strang has assured me that the experience will be much better. As well, last week's restrictions are lifted, and that's a credit to everyone who showed up for testing and remains vigilant. And so I hope that you do that and you enjoy this weekend. But remember, despite the low case numbers, we still must keep in mind the public health guidelines. Continue to wash your hands, keep your distance, and wear a mask. Thank you for following the health protocols and for hanging in a bit longer. We'll get through this together. Thank you.